Welcome to my latest update on the workings of the governing body. We met last week. The first thing was that we reviewed the end of the financial year. Most of you will be aware that we faced a significant deficit back in last September, and it reached £22.5 million. I'm pleased to report that with all the hard work of the team and staff working together, that actually reduced that to below £11 million, close to 10, and that's a significant achievement, and that was recognised in a recent meeting with NHS England, that they felt the team were working really well and in the right trajectory. We are planning for a deficit of £5 million in this year, which is 17-18, but by 18-19 we'll have to move back to in balance and making 1% surplus, and we're confident that with all our initiatives we can do that. A few things just to mention really that you might find of interest. We've recommissioned the Sherdley practice, which is in St Helens rather, and that is part of our borough-wide frailty strategy to create a more equitable service for those who are most frail elderly, and that work is in progress. Another piece of information you might find of interest is a report on public health we were discussing last week. Some of you, those who have children, may have found some access difficulties in getting your children immunised. We've always had really good results here in immunisation. We've looked at the reasons why, and in fact we're working with NHS England and the practices to provide more slots. So if you are looking to have your child immunised, don't give up, please contact your local surgery and get a new appointment. The challenge of demand and cost is still with the NHS, as you can already see, going on. And again, we would encourage all those who are going to Wiston for the A&E services to really only use that if it is what it says on the tin. It is an accident or it's an emergency. Consider using other services such as the walk-in centre, your own GP surgery, and the care at the chemist. We've been also improving spirometry services across the borough to provide a greater equity across the borough, those who need those services to do with their breathing difficulties. St Helens Cares and the People's Board, that work is now gathering at pace. Those meetings are advertised on the council website and they are open to the public, and so if you are interested, you are very welcome to attend to see what is going on. We've certainly achieved some national interest from the Cabinet Office about what it is St Helens is doing in our integration between health and social care, together with the wider partners of housing and fire service, ambulance and the third sector. There's a consultation underway at the moment in terms of what's called PLCP, Procedures of Limited Clinical Priority. And you'll see that going on at the moment, and those who are members of PPGs will also see that work going through. And we had our recent patient engagement involvement group just last week, which again was very active and very, very exciting. Those are the key headlights really. What I would say to you is, if you're interested to watch this and you're not a member of our CCG, then please consider joining. It's very easy. You can find the information on the website, get more involved, and you can be as involved or as less involved as you want, but it makes sure you get information through email much more quickly. So I would encourage you, if you want to do that, then please, there's no fee, it costs you nothing, you're not asked to do any work, but it is something that keeps you more in touch with us and also helps you to give us feedback and become more involved. So thank you very much.